Well, I've had two babies. So the first time my daughter was 14 months when I came back to work, and the second time around was a lot earlier. It was 9 months when I came back to work. It's interesting because I had both different spectrums, I guess, with coming back to work based on their ages. So my daughter wasn't entirely dependent on me when I came back to work, but I still had to maintain my supply as she still was feeding quite regularly. My son was feeding quite regularly and still very reliant on milk feeds. So getting ready to come back to work, I had to schedule in my pumping at work at least twice in a shift if I could find the time. And I think you just need a lot of support around you in doing that. There were a few times where the managers allowed my son to come up to the ward to feed him on the ward because unfortunately he would not take it via a bottle. So I was pumping purely to maintain my supply, but he would occasionally take it in sippy cups or in popsicles, so it wouldn't go to waste. I did end up with a few blocked ducts every now and then, and that was just purely because sometimes work just gets so busy and you don't have a chance to run out and pump when you actually need to. But I was able to manage that quite well with some hand expressing, worked beautifully to relieve all that. And then it was just a matter of keeping on top of expressing and feeding him regularly when I was home. Breastfeeding isn't easy. It's even harder coming back to work, leaving your baby and wanting to maintain that supply for them as well, to breastfeed for as long as, I guess, your goal is. I've always breastfed my babies until they were ready to wean, so that's still my goal. So I think it's a matter of planning, having the right support around you, and just being confident in your journey and being happy with your journey.